listening. I know that we're a small group here. But my name is Julie Valerius, and I am a student at McKendree. I'm working towards my Bachelor's of Science degree in nursing. And part of our homework that we're doing in this population health class that we have is to do a presentation and to have it recorded, so I apologize for that. But I just want to let you know, the purpose of this presentation is actually for you as parents, teachers, or nurses to be able to take something like this and show your students and your children and your patients some of the things that we run into here in Monroe County when it comes to sexually transmitted infections. I know that we are a small community, and this seems like something that doesn't appear to be on our radar, really. But for being a small community, we need to take into consideration that we do have some sexually transmitted infections in the county, and we are surrounded by both St. Clair and Randolph County, which in the state of Illinois rank higher than we do as far as STIs, as well as thinking that we are right across the river from St. Louis County as well. So we are surrounded by counties that will affect us. So that's something to consider. Also, today and age with technology, when we think about the dating websites and how easy it is to meet other people so that you can partake in sexual activity. So I just want to show you this presentation that I created that you can take with you and present. And it's geared mostly towards adolescents. So we're trying to get these children and these adolescents before they get to be sexually active. And if they are sexually active, what signs and symptoms to look for and how to prevent the spread of any STIs. So, what you need to know about sexually transmitted infections. What are our objectives that we're going to talk about tonight for this presentation? What is an STI? We're going to talk about truths versus myths. There's a lot of myths out there when it comes to sexually transmitted infections. And so we're going to discuss a little bit of some of those. What are some of the common STIs here in Monroe County that we're seeing? How do we avoid contracting an STI? Symptoms and treatment for these common STIs, and when to call and seek medical attention if we see that this is something that's becoming a problem for. So first of all, what is an STI? We used to call them STDs, now they're calling them STIs, we're calling them infections, but it's usually spread by any kind of sex. Some even spread from skin-to-skin contact. So especially if there's an open sore area or lesions, things like that, you need to be careful because it can spread it that way. And we need to remember that it affects both males and females alike. No one everyone is vulnerable to contracting STIs. So here's a myth for you. If you have oral or anal sex, you won't get an STI. Myth, right? The truth is, they can be spread by any type of sexual activity. That's vaginal, anal, oral, and it also includes, as a matter of fact, sharing toys. So those are things that we need to take into consideration. Here's another one. If you have sex in a hot tub or pool, you can't get an STI or an STI because the chlorine kills off all the bad stuff. False. The truth is, chlorine does not kill the bacteria during sex, and neither does hot water. So having sex in the water with a condom can be dangerous because then the condom is more likely to break. So that's a complete myth. What are some common STIs that we have here in Monroe County? Herpes, HPV, gonorrhea, syphilis, and chlamydia. So all of these are present here in Monroe County. We do have some HIV cases as well, but these are the most common STIs that we're going to see. So first of all, let's talk a little bit about herpes. What's a myth about herpes? You can get it from a toilet seat. Don't you guys remember hearing that when you were younger and your moms told you not to sit on the toilet seat? Well, that's a myth. There are no proven cases of this. It actually dries out very quickly in the air, so using the same toilet seat as someone who's infected is not going to give you herpes. I had sex with someone who has herpes, but I still haven't had any symptoms, so I'm in the clear. Also a myth, because the truth is, a lot of times there are no signs and symptoms for herpes. As a matter of fact, 50 to 80% of infected people don't even know they have it. So if you think you might have herpes, you need to get tested. So some of these pictures can be a little bit graphic. When we talk about herpes, we know herpes is a virus. It's caused by a virus, herpes simplex 1 or herpes simplex 2. It can cause sores around the areas around the vagina, penis, mouth, and lips. On a side note, for all of you as my audience, I know that some of these pictures can be pretty graphic, but I want you to take into consideration that we're trying to get to these adolescents with a little bit of a wow factor. We want them to really understand that this is something that can be very serious. So how is herpes spread? Well, that virus lives in the fluid within the sores. So when you touch these sores, the fluid spreads. So this can occur during any type of sex, and it can even be spread through saliva. If your partner is not showing out any signs or symptoms, or they never have, you can still spread herpes. So it's important to make sure that you and your partner know if anyone has herpes. Here we have signs and symptoms. So you're going to see some blisters or sore areas on or around your vagina, penis, or mouth. You may have a fever. There might be some smelly discharge, burning when peeing or urinating, and many people don't really show signs and symptoms at all. And here again we can see some pictures of where it can be affected. We see a female with some herpes and also male. So how do we screen for herpes? Well, there's a blood test that you can take. So a blood test by a doctor shows whether or not you have herpes. And something important to remember, that there is no cure for herpes. There's no cure for viruses. So you can treat the symptoms, but herpes will never go away. Once you have the virus, you have the virus. Some meds can help treat the symptoms, making it less painful or noticeable, but you will always have herpes and you will always be able to pass that on to your partner. The only way to completely avoid herpes is to not have any type of sexual intercourse. Is this ideal for adolescents? Absolutely it is. Is it reality? Probably not. So we need to teach them how to correctly use a condom. However, that's not always a likely fix either. They can occur in places other than the penis and vagina, so a condom is not completely protective. We've all seen cold sores, herpes in the mouth. Now let's move on to HPV. HPV, as you know, is one of the most common sexually transmitted diseases. Many people up to 50 to 80% of sexually active people will have HPV. Again, it's a virus. So myth. I'm a guy, so HPV won't affect me. There's no need for me to get the vaccine. False. The truth is that even guys can get cancer from this HPV. So it can occur in their mouth, their penis, their anus. And if they get the vaccine, he could help to prevent the spread of HPV with his female partners. Here's another myth. I don't need to get the HPV vaccine because I'm not having sex. The best time to get the vaccine is before you start to become sexually active. So they work best when given before any sexual activity. Getting the vaccine at age 11 or 12 has been shown to actually reduce the spread of HPV. So what does HPV stand for? Human papilloma virus. It is the most common STI in the United States. At least 50% of sexually active people will get this. Depending on the type of virus, you can get warts or even cancer. So keep in mind there are many different types of this virus, up to over 100. And most types can go away with time. For example, 90% can heal themselves within 2 years. But keep in mind, within those 2 years, you could have spread it, to someone else. If you think about that spider web, and I'm not sure what they're teaching today in health class, but they always say if you have sex with somebody, you've had sex with every other person that that person has had sex with. And that's a true statement. If you think about it as a sort of spider web, right? Me having sex with someone is the same as me having sex with the people that he's had sex with, because perhaps he has brought something with him from those partners. So when you have sex with someone, you're choosing to have sex with every person and every other partner that that person has had sex with. And sex is not just vaginal sex. There's anal sex, there's oral sex, it's all still sex. Oh, I'm gonna go back one. See if I can previous this. Sorry guys. Bear with me. There we go. Okay, so HPV, how's it spread? Vaginally, anally, and orally, of course. It can be spread even if the infected person has no signs or symptoms. And many times this is actually the case. They're not going to have signs and symptoms of having HPV, which is why it's so spread and it's the most common STI in the United States. It occurs when there's contact with infected fluids or infected membranes, so that's the penis, the vagina, the anus, the mouth, and the throat. And they can enter through really small cuts and tears. That's how the virus gets in. So here's a picture with some vaginal warts. It shows what they look like. Some signs and symptoms. It's going to depend on what type of the virus you have. And sometimes it can take up to years for it to show up. So here's a papillomavirus that you can see right here. Genital warts, they look like bumps. They can be big, small, flat, or even raised. And those can cause cervical cancer and other cancers, like such as vaginal cancer, penis, anus, and in the back of the throat. So this is something that you can get cancer of the throat because of HPV. It's not uncommon. Screening. As women and young women, adolescents, getting an annual pap smear is routine, and they will be able to catch that HPV in your pap smears. A vinegar solution test, the doctor uses this, and the infected areas of HPV will turn white. There aren't any approved tests to find it in the mouth or the throat. So in most cases, it goes away on its own and it doesn't cause any problems. However, it can. No treatment for the virus itself. The problem caused by HPV can be treated. Genital warts can be treated by you or a doctor, and there's a lot of different ways to get rid of them. Cervical cancer can be treated, but specific treatment varies case to case depending on how bad it has spread and how bad the cancer is. So this is a cervix, as you're going to see it through the speculum as the gynecologists see it, and that's where they're going to see those lesions around there, those HPV lesions. So prevention. Females and males should get vaccinated. Everyone should be vaccinated before they become sexually active. It's good to get vaccinated around the age of 11 or 12. They are safe and effective. Using condoms, of course, always helps, but it can infect areas that are not covered by condoms. So, like the mouth and the throat cancer that we talked just a little bit about just a second ago. Gonorrhea. Gonorrhea, of course, is another one of our notorious STIs, and we do have it here in Monroe County. Here's a myth. It goes away on its own, so it's really not a big deal. Fact is it is curable, but it doesn't go away on its own. It does need to be treated. And it can have some serious long-term effects. So, here's a picture of some gonorrhea in the vagina. Here's also another picture of some gonorrhea on the penis. Very common between the ages of 15 to 24. Affects both males and females, as you can see. Causes infections in the penis, vagina, anus, and throat. Do you see where this is going when we all think that oral sex is not considered sex, right? It's spread by having vaginal, anal, and or oral sex with an infected person. So you can see that that's what it looks like. Here is gonorrhea in the mouth. Sometimes there are no signs and symptoms, but if you do have signs and symptoms, it could be things such as painful or burning with urination, itching, soreness, bleeding, or some leakage from your anus, a sore throat. Women can have increased fluids from the vagina and maybe some bleeding or spotting, and men will have sore and swollen testicles and some unusual fluids. So yeah, we see why it's important that condoms need to be worn even during oral sex. So screening. If you notice you or your partner experiencing any of these signs or symptoms, you should get tested. Doctors will usually have you just urinate in a cup, and then you may or may not be swabbed if it's in your anus or in your mouth. It can be completely cured, and your doctor will have to give you a medication to help with the pain until the infection is gone. So keep in mind, this isn't just spreadable, but it is curable, but it is painful. It's very painful. So here's some gonorrhea in the rectum. In the eye. Bet you didn't think that could happen, right? So, think about, if it's fluid, it's fluid. So if sharing of fluid is going on anywhere, and your hands are touching things, and then you touch your face, that can spread, and so you need to really be careful. So abstinence, of course, is the biggest, #1 way to prevent. Condoms, however, you should even use condoms, because fluids on your hand can still pass the infection to your eyes or your mouth. No one wants that. Let's talk a little bit about syphilis. Now, I know there are 3 stages of syphilis. So it's really important. Syphilis can actually cause death if it goes into the 3rd stage and is not treated. So here's a myth. If I've already had it once, I can't get it again. That's not true. You can get it over and over, even if you've been treated. So it's a bacterial infection. We all know with bacterial infections, they can be treated with antibiotics. So it causes small sores around the mouth, vagina, penis, and anus. If it's left untreated, it can spread to the body, to other organs, and eventually to the brain. And it just sort of eats away. And I think, I can't remember, but I think one of the famous, one of the famous gangsters, I think, died of syphilis. It got to the tertiary stage and he kind of went crazy. So it can spread if it's not treated. So here you see some pictures of the sores. A person gets syphilis by having unprotected oral, anal, or vaginal sex with someone who has syphilis. Again, this can travel with just fluids. So this gentleman right here, I'm assuming it's a gentleman, and I'm sorry, I probably shouldn't. He has a sore right here on his forehead. This is the top of someone's mouth, so that's the palate of a mouth. And this is someone's hand where it's gotten into tertiary, that's the 3rd stage of syphilis. So, it's real, it's out there. So what are the signs and symptoms? You can have some sores on their penis, scrotum, or around the anus and or in the mouth. With women, it's the same thing around the lips of the vagina, the anus, on their breasts even, or in their mouth. As you saw that one picture, someone did have it on their head. They're usually painless. So syphilis is painless. The sores can last 2 to 6 weeks. And even though the sores might go away until the infection is actually treated from your blood system, syphilis is still there. So it's important to get it treated. 3 distinct stages, and if left untreated, can progress to stage 3 and can cause death. So what's a screening? If you have a sore you can see, the doctor can test it to see if it's syphilis. If you think you might have it but you don't see any sores, you can still have it, so you need to have your blood tested. The only way to completely get rid of syphilis is with antibiotics, and your partner also needs to be treated. Again, prevention, abstinence, using a condom, and getting tested each year to prevent it. Chlamydia. If I get chlamydia, I will know. The signs and symptoms are really noticeable. False. Fact is almost 75% of women and 50% of men actually have no symptoms. So if you think you've been exposed to chlamydia, it's important to get tested as soon as possible. Something to keep in mind. So what is chlamydia? It's a common STI that affects both men and women. It can cause discomfort, bleeding, and unusual discharges. You can see there are drips, and there's a lot of discharge here in the vagina. How does it spread? Through vaginal, anal, and oral sex. Spread through the contact of membranes, especially if there's some small tears or sores that you might see. So how does chlamydia kind of affect this? I just saw this picture and I just wanted to share it with you. So a normal route of an egg from an ovary to the uterus, right? It goes down from the ovary down through the fallopian tube and then it implants into the uterus. When you have chlamydia, sometimes it can cause buildup of some scarring, which will completely block that passage, causing some infertility. Symptoms: burning, itching, and discharge. So most don't have symptoms, but if they do, they usually include discomfort or bleeding with sex, unusual discharge from the vagina, burning with urination, and if an infection spreads, you may develop pain during sex, stomach pain, upset stomach, and or fever. Same thing for the men. Their burning and itching is around the penis, however. So screening, women under the age of 25 should get tested at least once a year to go ahead and prevent this. Men who are sexually active should see a doctor if they notice a discharge or feel a burning around their penis. It's important to get that looked at. Treated and cured with antibiotics, but of course, again, it's important to take all of the prescribed antibiotics. I'm not sure if you all know that there's people don't use antibiotics correctly, and now we're having resistant to antibiotics sort of diseases and infections. Get tested, get retested 3 months after your treatment, and if left untreated, it can lead to very serious lifelong complications, including not being able to have children and infertility. Prevention, again, we have abstinence and condoms, only having sex with one partner who is also only having sex with you, and having your partner get tested. So I kind of like this one, chlamydia. It's spelled really funny, so a lot of people don't know how to pronounce it. 4 out of 10 can't pronounce it, 8 out of 10 don't know they have that. That's pretty sad statistics, I would say. So let's remember, the only way to prevent an STI is from not having any type of sex. However, if you do have sex, you need to be protected. Wear condoms, wear them properly. A little thing about condoms, they are available for all ages at convenience stores, grocery stores, gas stations, etc. Everyone buys them. Everyone can buy them. They're available for free here at the Monroe County Health Department. Colleen can go ahead and get some for anyone to take along with them. Let me end with a couple more myths, however. Be extra safe and use 2 condoms. You should never use more than 1 condom at a time because using 2 makes it more likely that the condom will break. You don't need a condom for oral sex. As we saw some of these pictures, and we see that a lot of times some of these infections can be transmitted through oral sex. So it is very important to wear condoms for oral sex. Use a condom even for oral because many of them, including gonorrhea and chlamydia and herpes, can be passed through oral sex. I don't want to use a condom for sex. They make it not as good for the guy. As a matter of fact, it's not going to ruin the moment. It can actually start to spice things up. They have condoms now in different colors, different flavors. Some of them glow in the dark, different textures. Important, however, to understand, though, our condoms need to be made out of latex or polyurethane. Those are the 2 that have been proven to stop the spread and the transmission of STIs. Things like sheepskin condoms, those won't stop the spread. So, I know that our adolescents today, they can go to YouTube. Everything's on YouTube. You can find a YouTube video about anything. There is a correct way to use condoms. You can just Google it, go to YouTube, and correct way to put on a condom. Carefully tearing open the package, pinching the tip to remove any air, fitting it on before any sex has started, all the way down to the base. After ejaculation, you remove the condom, you tie it, and you throw it in a trash can, not in the toilets. So what now? I feel like I might have an STD. What do I do now, right? So if you feel you have any of these symptoms, it's important to get looked at as soon as possible. Many of these conditions can have lifelong consequences if they're not taken care of. So you need to get tested ASAP. Talk to your doctor. You can call 1-800-CDC-INFO, or you can always visit www.cdc.gov/STD. Does anyone have any questions? I want to thank you for giving me the time to let me show you this presentation that I came up with. If anyone would like to use it or share it, talk to the school board, talk to the health teachers, talk to your children, and anyone with else, you are more than welcome to. If you want to get some sort of a group together, as much as I would love to have a gym full of adolescents right now to talk to, it's not really the case. So I'm going to have to start from the top and trickle down a little bit. So I'm starting with all of you, and hopefully you'll be able to pass it along. And if anyone needs me, you know where to find me. So thank you. I'm going to go turn this off.